It is 22 minutes past 6. Businesses in Auckland CBD are becoming increasingly frustrated with antisocial behaviour outside their venues and are seeking more powers to move people on. That may include conversations around how to deal with people living on our streets. The call comes as rough sleepers in Rotorua could face being trespassed from the city's reserves. For more, we're joined by Haahi the Chief Executive Viv Beck and Lifewise Chief Executive Haahi Weteriana O Aotearoa. Thank you both so much for being with us this morning. Viv, let's talk about the issues that businesses are facing in Auckland Central. What are those and what is the proposed change that you're looking into?
Well, there's a range of things, and some of it relates to crime, and we've been asking for more police on the street. Some of them are significant social issues like mental health and addiction, and we are asking for a stronger response on those social issues. We understand they need specialist support, but there is also just some really bad behaviour happening, and because we haven't had as many police as we'd like, and some of them aren't actually necessarily at that sort of criminal end, but they are bad behaviour happening outside businesses on the street, affecting people badly, whether it's a resident or a business. And what we're just suggesting, we really would like to be talking to council, police around, and we are actually, about what are the ways to address this, but it has heightened in intensity. So one suggestion is that as well as being able to trespass from a private property, which happens now and actually can happen quite successfully, is that if you've got someone who's continually causing trouble, that there is actually the ability to trespass from a public place. It's just a suggestion, but we're at a point now of intensity. It is one of the biggest issues that is coming up to us all the time. When
you're talking about people creating trouble outside of these businesses, are there any examples that you could give us about what kind of behaviours are being displayed?
It could be intimidation, it could be screaming obscenities at people, children, elderly people in broad daylight. It could be urinating, defecating in people's front doorstep. You know, these things that are happening, and it's some of it is really scary for people. People are caring. They understand that sometimes it's clearly someone who's not well, and that person needs specialist help. But some of it is just really scary, intimidating behaviour that people are scared of.
Hi, now I know that you two have had conversations around this, not only before you came on the show, but actually and amongst trying to sort out some of the issues that are being experienced in the central city. But we're talking about a whole number of issues, right? Yeah.
I think firstly that, you know, the crisis and the call out is that we have an issue with family whānau being placed in, if I look at the emergency motel environment and the decantering of whānau coming out to our communities, we need to have a real coordinated and planned approach. So if the mental health and addictions is not addressed and we don't have the expertise around workforce capability, we aren't going to see any reduction in what the behaviour that the community and the public are seeing. If we're not addressing social exclusion, if we're not identifying that whānau need to be socially included again, how do we coordinate that? We again are going to see what is looked at as bad behaviour, and there are some bad behaviours that are happening within our CBD here, Tamaki Makaurau, and also Te Aroha Hoki. So we need to build a coordinated workforce approach. Our positioning around delivering appropriate services relies on an equipped and fit-for-purpose workforce. If we are stretched, and I look at the police, a punitive approach will just stretch them, and they're already stretched. Trying to address social issues that are happening within this environment. We believe, and I'll use an example that we have here on Karangahape Road, we have the Merge Cafe, and that is for peer and street workers to come together to work within the environment of the streety whānau. But we also need to resource environments like that with specialist services that would have clinical appropriate teams available, but not coordinating the lead out of the support. We need to have developed resource in the communities. Auckland Central, we have Auckland City Mission, we have Lifewise, we have Street Guardians, we have the Māori Wardens, but we're not coordinating together. So we're all trying to address the same issue, but we're siloed ourselves. So to come together, to be able to put out an action now, we have to have a planned approach.
You know, unfortunately, I worked in the police force many haircuts ago, and that was still the issue back there, is everybody working in silos and nobody actually working together. I've got to wrap things up, and I feel like this is a conversation that needed to be a lot longer, because the solutions are bigger than a bylaw.
Yeah.
Right?
Yeah, and we understand that, and we've actually seen pre-COVID how working across the agencies was very successfully housing, for example, rough sleepers. So we're not suggesting this is a stick. Well, in a way, at the moment, we need something to help deal with a significant situation where there's fighting and things, but the reality is we do need a more sustainable solution. I agree with that, but right now there's an issue and we need some action.
Yeah, and it needs to be coordinated.
Yes, definitely.
But there's also businesses that need to, get on with doing what they're doing.
Yeah, they do.
Anyway, thank you both so much for coming in, for touching on this subject, which really does need a bit more time, but we really appreciate you both. Viv Beck, Heart of the City, and hi to Barrett from Lifewise NZ.
Kia ora.
Thank you.